in Peterborough. So all of these things we were able to bring to the table, which, you know, we feel, having worked in Peterborough for the past 7 years, meant that we were able to bring together all of this key knowledge to the project to help to shape it. And also some of the things that we talked about were what sort of things work and don't work well in the Muslim community. So, for instance, there are certain types of workshops we've run in the past and we felt like they haven't been very well attended. And it could be that those are just topics that make people too uncomfortable, or that you know, they're not they're not going to work. So we had to really sort of think about what elements we wanted to bring to Starting Well and to connecting Muslim mums. Sorry, Mumtaz, next slide, please. So as I mentioned before, one of the key findings from CPSL Mind was that although Peterborough has a significantly large Muslim population, the local Muslim women were just not accessing their services. They had very, very few Muslim women accessing their service. They have worked predominantly with non-Muslim women across Peterborough and Cambridgeshire. And I think, Mumtaz, you can correct me if I'm wrong, I think they had about 7 women out of those 450 that identified as being Muslim. So that shows that the context and the need for why we needed to make sure there was a more tailor-made service to bring Muslims in as well. So we had a few key objectives as part of this project. The first one was to explore the barriers. Why is it that Muslim women aren't accessing professional services? We know that in Peterborough there is quite a lot of work going on in terms of perinatal mental health work, but we knew that there was, you know, the level of engagement just wasn't there. Sometimes it's about trust. So, you know, we spoke to a number of families who felt that perhaps they had to be careful about what they shared. They had to be careful about, you know, whether or not they could speak to a certain professional, whether they felt they identified with them or not. All of these barriers were, you know, we wanted to make sure that we were addressing some of them. And then the second one was to work on CPSL Mind's already established perinatal service. So they already have a Connecting Mums course. They already have other courses they offer as part of their offering. And we wanted to make sure that we had redesigned them in partnership with CPSL Mind to make sure that they were easily accessible by the Muslim community. And then the last one, which we're still working on at the moment, is to develop evidence-based good practice. So part of this is about not only sharing our learnings and experiences, but also about, so we're working with an organisation to do an evaluation project at the moment, and there'll be a hefty sort of robust report that comes out of all of this, which we really look forward to sharing. And that will, you know, it will kind of it will provide a really good overview of the whole project from start to finish and how we went about doing it, what our ethnographic research looked like, how we identified our project workers and perinatal workers, how we brought peer designers on board, you know, how we tailored the service, what kind of key considerations had to be taken into account, all of our findings, and then of course all of the feedback from the service users as well. So we're looking forward to sharing that learning with you when it's out as a report. So before we started on the project, we, as I mentioned before, we did some ethnographic research and we put together an insight report to help inform this new service. Now, some of the key themes that came out of this were, as we have listed here. However, we knew that we weren't, you know, our intention was not that we were going to go in there and say we're going to be able to fix all of this overnight for anybody, or, you know, address all of the issues that have arisen. However, the 4 main ones that came out of this was the awareness of mental health knowledge, the loneliness and social isolation, the self-care and the stigma. So we took those 4 and we worked on those. So all of the content that was developed as part of the courses that we delivered was focused and centered around these four main themes that women felt were the main issues they had in their lives currently. And also, just to let you know, the Insight report is available online. I think if you just Google CPSL Mind and the Lantern Initiative, the Insight report should come up as well. But I believe Celeste would also be sharing the Insight report as part of this presentation. I'll now hand over to Mumtaz to give you an overview of what the course actually looked like. Thank you, Mumtaz.
Thanks, Sephora. So, as Sephora mentioned, CPSL Mind's perinatal service has been supporting the well-being even of mums during the perinatal period, which for our purposes is from pregnancy to when the mum's youngest child is about 2 years old. And it's been doing that for about 7 or 8 years through a range of services. So they offer Connecting Mums and Mums Matter structured programs, Mindful Mums, peer support groups, and also one-to-one support. So, as again, Sephora mentioned, the peer designers' findings highlighted a number of recurring issues that Muslim mums had faced or were facing, and we decided that an adapted version of the Connecting Mums course would be most suited for them. So what we did was add to the existing program to make it more appropriate by including Islamic teachings that were relevant to each of the themes covered, to show that not only is there no conflict between Islam and looking after our well-being, but that they're actually in harmony. And we called the new program Connecting Muslim Mums Inspired. So just like the existing Connecting Mums course, it's a 6-week program that's based on the 5 ways to well-being, and it gives mums an opportunity to connect with other mums who are pregnant or have recently had a baby, to discuss and get support from each other about feelings of low mood or anxiety in a safe environment, and also learn new ways to keep well, which they can build into their day-to-day routines. And we offer face-to-face and online versions of the course. So the first session of the course is about our hopes and expectations around motherhood and the actual reality of it, which we know can be very different. And the next 5 weeks are structured around the 5 ways to well-being, which are be active, take notice, keep learning, give, and connect. I'm sure you've all heard of these. The sessions include breathing techniques, check-ins and check-outs, discussions on the week's area of focus, as well as Islamic meditations and relevant Islamic teachings. So, for example, in the session about learning, we'll talk about the emphasis that Islam places on increasing our knowledge, and we'll discuss ways that they can, that the mums can increase their knowledge, given their new circumstances. We also offer one-to-one support to mums who would benefit from that kind of support, and peer support groups, which we call Muslim Mama meetups. Now, as we've delivered the programs, we've realised more and more that the recurring issues faced by Muslim mums from the initial research, the most common ones are loneliness and isolation, not understanding the importance of self-care, and also a lack of awareness about mental health and the support available. Of course, these aren't exclusive to Muslim mums. They're faced by most mums, regardless of faith, background, ethnicity. Feedback from the course has been very positive. Mums have enjoyed having a space to connect with one another. They like the informal style that we use, the inclusion of Islamic teachings, and also the check-in calls that we make in between sessions. They've really been appreciated. And we're constantly tweaking the program as feedback is received so that mums benefit from it as much as possible. And they told us that they want more opportunities to talk about their experiences in the course and also outside of it after it ends. And this is how the Muslim Mama meetup sessions came about. Also signposting to other forms of support. Okay, so I'm going to stop sharing for a moment. And I'd like to introduce you all to a couple of our lovely mums who have attended our Connecting Muslim Mums programs. Farah is mum to a little boy who is now nearly 3 years old, I think.
Yeah, he'll be 3 in May.
Yeah, and she's also pregnant with her second child, and she connected our first Muslim Mums course. And Maysoon attended our second course and is mum to 2 little girls. One, again, almost 3 years old, Maysoon, and the younger one about 18 months old. Maysoon, are you there? I don't know if she's there. Okay, we'll start with Farah. Hopefully, Maysoon. I will see if I can see her. Check if I can see her in a moment. So Farah, if I start with you, how old was your little boy at the time you contacted us, and what were the challenges that you were facing, and what ultimately made you sign up for the course?
Yeah, so my little one was almost 2, and I think the biggest challenge was due to the fact that I'm not from Peterborough, so I moved here from, sorry, he's here as well. Moved here from Birmingham about 5 years ago, and so I hadn't really had the opportunity to make many friends or meet anyone. And then obviously my little one was born during lockdown, so May 2020. I'm sure we all remember that month. Yeah, it was very, I mean, being a new mum is isolating anyway, but obviously during lockdown, you know, everything closed, all the classes closed, not being able to go and meet family in Birmingham. It was quite isolating, and as much as I enjoyed that time with him, bonding and, you know, really getting to know him and myself again as a new mom, you know, there was obviously something lacking. So I think it was about so he was almost 2 when I got in touch with the Connecting Muslim Moms. So someone sent me the poster, and I just saw it as a brilliant opportunity. So in between lockdowns, I had managed to attend, I think, like one or 2 classes, but then again, because of lockdown reoccurring, they would just stop. And then, yeah, so I hadn't really met anyone since becoming a mom, and I just thought, yeah, it was perfect timing. I was feeling very lonely, feeling very low at that point, and yeah, so I just thought, okay, this sounds really good. You know, it's for Muslims. It's 6 weeks. It's, you know, it's just one afternoon a week, and I can easily get out and take my little one with me. And that was quite important, because it's hard to find someone to always take care of your children. So it was good that we could take them with us, and they'll, you know, be looked after as well. And yeah, so that was the point at which I thought, okay, yeah, I need to do this for myself. Yeah.
How was it that you actually found out about it?
So someone that I know sent me the poster on WhatsApp, and yeah, so I think I immediately got in touch, pretty much immediately.
Brilliant. Yeah. Maysoon has said, by the way, that she couldn't be allocated to a breakout room from her phone, so she's coming in via her laptop. So hopefully she'll be here shortly. Brilliant. And I think what you've said about, you know, the background and, you know, coming into new to Peterborough, and that those feelings of loneliness and isolation, which are just like were completely magnified during lockdown,
yeah,
have applied to so many of the mums that joined us. So it's really good actually that you took that first step, because it always has to come from us, doesn't it? That
yeah,
first step.
definitely.
So what were your, I don't know if Maysoon I can see Maysoon is here, but I might just give her a couple of minutes just to settle in. So what were your highlights from the course? Was there anything that particularly resonated for you?
Yeah, so definitely just having that space, like having a space where just, you know, there were just a few ladies. I'm not a very confident person, so I think if the group had been bigger, it might have been harder for me to want to share things. But yeah, it was intimate, and just everyone was very friendly, and it was just nice to have people that you can relate to. So obviously everyone was Muslim, and they were all new mom, like fairly new moms, and yeah, just having people to relate to, and then also just having someone make you a cup of tea and being able to have a warm cup of tea, which doesn't really happen much as a new mom, does it? Yeah, so that was, I don't know, these kind of things were actually made me very emotional, like just someone giving you a cup of tea, giving you a biscuit, someone playing with your child, someone, sorry, he wants to be part of this. Okay. Yeah, so that was the like highlight. And then also just the little things, so we had sessions where we had the self-care session, so where we had to we made face masks, and you know, we were able to take them home and then apply them. Okay. And yeah, I don't think I'd applied a face mask since probably before Dawood was born. So it was just these little things and these little reminders of like how important it is to look after yourself. And what is she doing? to look after yourself, and that, you know, it's not becoming a mom doesn't mean that you just give up on yourself. Like, you have to look after yourself in order to be able to look after your children and those around you, because yeah, if you don't prioritize your own care, you will basically burn out, and that's not going to be good for anyone. So it was just these little reminders, and you know, things that you know but you kind of forget. Yeah, so it was all of that, and yeah, like I said, just the company, having that space to be able to talk. Like, I've never been a very open person, I've always kind of kept things inside, but I think just seeing other women being able to share their experiences and thinking, okay, like, no one's judging, no one's, you know, saying, oh, why is she saying that or anything, and it just kind of encouraged me to do that as well. So that was something that I definitely really enjoyed as part of the course. And yeah, it was something to look forward to every week. I really did enjoy it.
Thank you. And I think you said earlier that you're not confident, or you don't feel that you're confident. I would disagree. I think some of us just don't like big groups. But
Yeah.
You're confident, but we're just not, you know, we prefer smaller intimate groups, and it worked for you, which is really good.
Yeah, definitely.
And also thank you for mentioning about, you know, which I forgot to mention about, you know, we have volunteers, so we try to support the mums, as well as, you know, talking about giving them a space to talk to each other and talking to them about the 5 ways to wellbeing. We try to support them as best we can. So we have volunteers that are there to help look after the children, so the mums can get the most from the course. And also, they're not allowed to make their own cups of tea. We make their teas for them, and just, you know, those little things which, you know, as mums, we don't really get that much. So yeah, thank you for mentioning that. Brilliant. Thank you.
Okay.
Okay, Maysoon, I'm going to come to you. I already introduced you, but I'm going to tell you what I said to the others about you. So I just said, I don't know if you're frozen. Maysoon, can you hear me?
Yeah, can you hear me?
I can hear you, but you're frozen. But don't worry, you look beautiful. So I just said that you attended our second course, and you've got 2 little girls, one who is almost 3 years old and one is around 18 months, right?
Yeah, that's right. Yeah.
Okay, so just wanted to ask you as well, just to share your experiences. So how old are your girls now? Well, I've just said how old they are now. How old were they when you contacted us? What were the challenges that you were facing, and what made you ultimately sign up for the course?
So I had my second then, I think she was around 6 months. My biggest challenge was not being able to leave the house. I hadn't left the house since my first. She was born in May 2020, so the first lockdown. And then, then once she was born, so many things happened. Like she came on her period, she was born with COVID. She had colic, all these things were it was too much for me. I was like locked up in the hospital room for so long, in isolation. I couldn't breastfeed. I don't know what was going on. So then when I came home and all those things happened, I felt as though if I was to open a window, she was going to die. And then since then, it was just really hard for me to ever leave the house. My husband has like a full-on job Monday to Friday. Like, even if he's working from home, he won't finish till 6:30 or something. So there was never really a chance for me to get out with my first child. So, and then I quickly fell pregnant with my second, because I felt like, I said it was accident, but it wasn't an accident. I made sure I got pregnant because I just felt like I needed something. I needed something to get me out of this. Then anyway, I was still going through all of this, and then come 6 months pregnant, my healthcare, I had to get Fatima, my second child, weighed, and I wouldn't go to get her weighed because I was too afraid to ask my husband to take time off work to take me, because how much is he going to do for me, you know? So I basically just rang the helpline, and I said, I'm not going to bring her to get weighed because she's going to cry in the car and I'm going to crash the car and we're both going to die. So they were like, okay, we'll come to your house to get her weighed. And then my health visitor, who was absolutely amazing, introduced me to the Connecting Muslim Mums course. And so that's how I found out about it. I did see it online and like in my local cafe and stuff, there was leaflets and everything. And then everything just kind of
piece together, because I wasn't going to go and look at the leaflet and say, okay, I'm going to go, because I wasn't in that state of mind. I needed somebody who I could trust and who I felt like understood me. And she was that person who then said that, you know, maybe this would be good for you. So I went and I thought to myself, do you know what, if I can just get somewhere out of the house by myself, then, you know, that would be amazing. It was really slow process for me. So like the first time my husband got Fatima ready, Khadija goes to nursery, my older one on those days. So he got her ready and put her in the car, and then I got myself ready. And then it got to slowly got to a process where I got her ready and myself ready. I put her in the car, got myself in the car, and I made it there. And I was just like, guys, I actually made it. I can't believe it. I done it all by myself. And then I think a couple of weeks later, I actually took her to town. And it was just like, I came in raving, like, oh, I couldn't wait to tell you guys I actually took her to town. And yeah, that was such a big thing for me. And also I found that, like Farah was saying, having that safe space and just being able to share everything and anything that is on your mind, on your chest, that really helped me a lot, because I didn't realize I had issues, not just from having children and stuff, but it was from like way back with my mum. So ever since I was little, really, I've never been close to my mum, and I was able to actually share that to somebody and just be listened to and understood. And I didn't realize what was going on, but after sharing so much and having somebody actually listen to you and understand you, it kind of, you guys guided me in the right way so I kind of like, I was able to let go and move on. I never ever spoke to my mum, and now I'm at a place where I speak to her literally every single day, about 5 times a day. And I didn't ever think that would ever happen. I thought that my biggest test in my life was my mother. And for like us Muslims, that's such a big thing. Like, your mother there's like, heaven lies under her feet. And I just thought, that's it, like, I'm going to hell because of mine and my mum's relationship. But you didn't only like change my life, giving me the confidence to be an amazing mum and an active mum. Like, I'm never at home now. Before I was like never out, now I'm never at home. But you've actually changed my life, like, with my own family, and I'm really grateful for that.
Mason, thank you so much for sharing. You know what, Farah, you were saying earlier about being in a small group and just it being easy to talk in that small group. Well, Mason's group was even smaller. We had 3 mums who were in that group, and at first we were, you know, we thought that, oh, the only 3 mums, you know, we aimed for about 7 or 8, and actually that was it just provides that even more intimate setting. And Mason, the development, like that, just the progress you made, you're right, like within a couple of weeks, it was just like, I went to town and I did this, and it was just amazing. It was just that you just needed, it was all in you. You just needed that little bit of encouragement for you to realize that, you know, you were able to do that. And I'm just pleased that, you know, we were able to offer you that. But thank you for sharing. Farah, oh yeah, sorry, missed the second question. So what were your highlights from the course? Was there anything that we spoke about that particularly resonated with you?
Oh, was it with me?
Yeah, please.
It was the one thing that I always remember is when you gave us a little bag of like chocolates and stuff, and I took away that hot chocolate and the chocolate and everything, and I said, this is just for me. Like, this is something that I don't have to share, because I used to feel guilty if I didn't share something, or if I didn't, you know, if I did something with one child and not the other, or if I did something by myself, and, you know, I'd feel really guilty. But I was like, no, do you know what, this is mine, and I'm going to go away into another room, and I'm actually going to enjoy it. And I swear to you, till this day, I do that. I'm just like, that's it, I'm switching off. The kids are yours. This is my time now. And yeah, I do that, and it's amazing.
And that's part of our give session. So we have that one of the 5 ways to well-being is about give, and we know it's about giving to others makes us feel good about ourselves, but we emphasize giving to ourselves because can't give from an empty cup, and we emphasize that. So in order for the mums to be better mums, better wives, better partners, whatever, they need to give to themselves first. So I'm really pleased that you've continued with that.
Also, so I started this whole skincare routine that I do, and that now my kids want to do as well. So I give them their Aveeno that they do. And now my husband has started his own skincare because he was like, I want to feel good in the morning. I want to be ready for the day. So my whole family is on this my time thing.
Perfect. Excellent. Thank you so much. Clara, I'm going to come back to you if that's okay. So following being on the course, how has life changed for you?
Oh, quite significantly. So I was happy to hear once the course was finished that you'd still be offering those peer support group sessions, because I thought, okay, it was 6 weeks. It's a good amount of time, but I need this to carry on. So yeah, it was just, so those continued on the same day, same time. So that was amazing because we still got to speak to people, still got to see the same friendly faces. So that was really good. And then it just kind of gave me the confidence to, well, it helped me realize that, okay, maybe I need a bit of support, some mental support. So one of the ladies from CPSL Mind, I actually started having one-to-one sessions with her. So yeah, I think, I can't remember how many sessions we had, but that was very, very helpful. Just having that one person to go to speak to her and just, open up about everything that was going on. So that was very, very significant. Also, I met Safura, of course, at the Connecting Muslim Mums, and she told me about the book club that she runs. So I joined the book club, and I had been looking for one for ages, so that was brilliant. So that's obviously ongoing as well. And yeah, just generally the confidence that it gave me to just go out, meet new people, talk about people, and like just not hide away like my achievements or my interests even. Like I don't know, I just always thought, oh yeah, no one's gonna be interested in that. Oh, people are gonna think I'm weird, that I like hugging trees or something. Like I just thought people would find me a bit weird, like, but no, it's given me the confidence to just be myself and just to like share my interests, share my opinions, and not really care what other people think, like whether they find it weird or not, like it doesn't matter. So yeah, that's been really good. And obviously I met Maysoon not that long ago actually, and it's just been nice to have a friend, and I've even been over to her house, and like our kids are similar ages, so it's definitely opened so many doors. I've met so many lovely people, and I think it'll just be ongoing. Like yeah, definitely, it's been life-changing really.
Brilliant.
So thank you.
Thank you so much for sharing. Thank you so much. And it's just amazing to hear like how you've we've kind of like, we see each other at the Muslim Mama meetups, but it's just always so lovely to hear how you've just taken it further yourself. We there's only a certain, to be honest, all we did was give you that, like, just make you see yourselves as as women in your own right, not just as moms. And it's just so nice to see how you've taken that further. So thank you so much. Maysoon, I'm going to come to you now, if that's okay. How has your life changed after the course?
It's like I'm living a different life. Not only is like all that baggage gone, I felt so free straight away after that. As soon as the course finished, I said to you, this isn't enough. I need to keep going with you guys. Like, I need to do something. And then the Muslim Mama meetups, like, they're just absolutely amazing. It gives you something to look forward to. I met Farah, which is amazing. The group, the Connecting Muslim Mums group that we were in, we're still like best of buddies as well. So we're always in and out of each other's houses and going to like different soft play sessions and meeting up at the mamas group together and everything. So that's been amazing. I've taken a lot on board, where from when I was pregnant with my first, through high premises, I didn't stop praying, even though like I was just bedbound at some point. You know, my husband would help me make wudu and stuff, and I'd pray in bed. But then after that, I completely stopped. I completely stopped to a point where my husband said to me, "Do you even want to be Muslim?" And I was like, "It really makes no difference to my life at the moment." To now, where I'm like praying 5 times a day. I'm back to myself, but better. Like I'm praying 5 times a day. Everything around me has become like how I wanted it to become. I wanted to evolve as a better Muslim, as a better Muslim mum. My children know how to, not fully know, but they copy us, and you know, and it's just amazing that I can feed that to them by just being me. And she knows like her Arabic alphabet, which is just, it's just amazing, you know. And also how now I've become a volunteer for you guys, and because I just want to keep giving, because I know how much it's changed my life, and you know, I just want to be part of giving that to other mums as well, even if it's just a little bit, even if it's just get out one day, even once a month, you know, whatever it is that I can help anybody else with. I'm down with that.
It's brilliant to hear. I think you know, like the energy and the enthusiasm that you bring to the sessions that you volunteer at are just incredible. And it's just amazing to see the progress. And Farah as well, when we've been at Muslim Mamas and you talk about tree hugging, just the passion and the enthusiasm that you both have is just so, it's lovely, it's inspiring. So thank you so much, ladies, for sharing your stories. I know it's not easy, but we really appreciate it.
Thank you.
What I'm going to do now is just share the slides again, just to share some other feedback that we've received. Hopefully you can see that. Just some other pieces of feedback that you can have a look at. And with that, I'll let you read it for yourselves. And that brings us to the end of our presentation. Sephora, well, the end of my part. Sephora, if I hand back over to you.
Thank you, Mumtaz. Thank you also to Maysoon and to Farah. I've heard this, I've heard all your feedback several times, and it still gets me. I tell you, it brings a lump to my throat. So yeah, thank you so much. And it's really, really beautiful to see how far you feel you've come, and how beneficial you feel the groups have been for you. Thank you. So just for the last few minutes, we just wanted to open up the floor to any questions. If anybody wanted to ask anything from either myself or Mumtaz, or even Maysoon and Farah. Jenny.
Thank you for sharing that. That was really powerful. Thank you. I just wondered, Farah, I know that you gave birth during COVID lockdown, so things were a bit different with maternity services, but I just wondered whether your midwife or anyone else had talked to you about perinatal mental health or the services that were available to support you, and if they did, whether you found them open to be able to support you.
Yeah, I think they were briefly mentioned, like the support that was available. I think when I had him at home, but I had to go into hospital, and they did mention there as well that like there is support available, and I think they give you like a number of like a counsellor or something. But I just remember it being really difficult to kind of get in touch with. I mean, I don't think I attempted to get in touch with anyone in terms of my mental health, but like just the health visitor. So I think the health visitor came once just to weigh him. I think that was the first time. Yeah, and just for that first initial chat. And then it was just so difficult to, I never saw my health visitor again after that. So it was just that once. And just to even get in touch, and they would just say, oh, if you have any concern, like I just had concerns about him, obviously, like with that you do. Yeah, so I just remember it being really difficult to like get in touch with anyone. But yeah, so I think the choice to kind of like, I didn't choose to really contact anyone in terms of mental health support.
And do you mind if I just ask a follow-up to that?
Yeah.
Did it make a difference that this was specifically for Muslim women?
Yeah, the Connecting Muslim Moms, definitely. I think it was just having that, being able to relate more the people around you, because I had attended a couple of classes with my little one, like a mum and baby yoga, and also a sensory class for my little one before I joined the Connecting Muslim Mums. And yeah, I mean, I just found, I mean, it was still, people were still in that lockdown mode, so there was a lot of like, see, isolation, what's it called, I've forgotten the word, that distancing thing, social distancing.
Social distancing.
Yeah, so there was the social distancing and people wearing masks and things like that still, and it was just a bit like you didn't know who to approach. And I just found like during those sessions there was no one ever of like my ethnicity or a Muslim. So yeah, it was always difficult to kind of relate to people. So having this being, you know, just Muslims was very beneficial, because it just felt more comfortable talking about issues that might also be related to like our religion as well. And then we had the Islamic meditation and just connect, you know, helping you connect to God and just your faith was very beneficial. Yeah, so I definitely felt more comfortable around the Muslim women.
That's really helpful. Thank you very much, Farah. Thank you.
I think also just to add to that, Jenny, one of our intentions was that, you know, for many women who might not be accessing services already, this was like a gentle kind of step into what else might be happening in the community. So, you know, for instance, people who access the Connecting Muslim Mums weren't aware of everything that CPSL Mind were offering. So I think just being there within that service, having tried one service, means that they now have access to all of the other things that CPSL Mind offers and wider as well. So we've been able to kind of, you know, as you've heard today, some of the mums have gone on to volunteer for different organisations and different charities. These courses have given them the confidence to access other things in the community as well. So it's been about, you know, if we give them something that's going to really help them connect with their own community, it gives them that confidence to then step out of their comfort zone and go, right, what else is there that I can access that might be beneficial to me? So yeah, it's really beautiful to see it all coming together, and to see women kind of, you know, taking it step by step and you know, accessing more and more.
No, it's brilliant. It's absolutely brilliant. Well done, you.
Thank you. Any other questions? I think we've just got a few minutes left. Kelly.
Once again, thanks Farah and Mason. I mean, they're really inspiring. I think when you hear lived experience, it's very, very powerful. So I really appreciate you sharing your stories today. In terms of the group under Mind, have you sort of reached out to other local Mind organisations to sort of replicate this model? Because it's clearly working, the feedback's amazing, and whether there's other, you know, so I'm up in Norfolk, and obviously we've now got, you know, we've got Mind there, and you know, then they're doing some really amazing work, and I wondered whether you've reached out to other local Minds to showcase your amazing model.
Yeah, so we haven't reached out to anybody at the moment because, well, mainly because of work capacity. But I think now that this is coming to an end, we're definitely open to sort of suggestions and different ideas and things. What we have had over the past couple of years is different organisations and charities contacting us for some advice on how to set up their own groups or their own services. I think there's a couple here that contacted us previously just to get some advice on their already existing perinatal mental health services and how to make them more adaptable and suitable for their communities. We've had some conversations with other NHS trusts around focus groups, how to bring Muslim women in more, how to kind of connect with their mosques and things like that. So we're definitely open to all of those conversations, and if we can provide advice and support to other people, definitely we would absolutely love to see more of this happening across the UK.
I might be in contact then.
Okay,
Thank you.
please do. Any other questions?
Sorry, it's me again.
That's okay.
Obviously with the NHS long-term plan around you know, the perinatal long-term ambition around access up to 24 months, but also offering partners that mental health assessment, how, you know, is that something, you know, I'm probably putting this question to Mason and Farah really, you know, would that be something that your husbands would take part in if you were to be accessing support from perinatal mental health services, and people asking how your husbands are?
Most definitely, because ourselves, we had gone through issues with my husband as well. After I started feeling better and stuff, it was a long time where he was like treading on eggshells because he didn't want to like trigger me in any sort of way. So then when I started feeling a bit better, and he was still, to me, he started acting weird, but he wasn't. He was just acting as if he had been behaving with me the whole time. So he wouldn't trigger me. So then I started saying, it's okay, you don't have to butter my toast straight away, because I'm not gonna, have a meltdown, or you don't have to, you can tell me how you're feeling. But he found that very difficult, because for a long time he was trying to hold me up and take care of both our kids, and help me look after the house and everything, because I had major OCD where I couldn't leave the house until everything was done as well. So he had to balance everything, and then when I told him you can relax now, he found it very, very difficult. Then like he started going through like some anxiety and some issues and stuff like that, so we did have to reach out for help for him, from different agencies and stuff. So yeah, definitely, I think that will definitely help.
Thank you.
Sorry, I'm just I've got a little one on my shoulder. Likewise, my husband is very supportive of that. Now, I'll be honest, I think it was this mental health thing was a bit new to him. So initially he was a bit, oh, okay, do you really need that? Like, because I always seemed quite put together, but I think it was something initially quite difficult for him to understand. Okay, is this necessary? But like slowly over the last couple of years, he's come to realize that it is important, and has even started thinking about himself and his own mental health. So yeah, no, definitely he would be supportive of using these services.
Thank you.
Thank you.
Any other questions? I think we've got just under 10 minutes left. Stella? Oh, you're on mute.
Hi, thank you. Could you share a bit more about the different ways and places that you promoted the service, and kind of, I know you said it's coming to an end, but like the different ways that it will kind of still be available and accessible?
Mumtaz, can I bring you in there?
Okay, so in terms of promoting, and Sephora, please chip in. Promotion has been tough, to say the least, I think. It was very much a learning curve. But I think we were initially sending things out via WhatsApp and on Facebook, Instagram, that kind of thing. And then, we started putting leaflets in local GP surgeries and anywhere we could think of, shops. But it took time. I think a lot of what really worked. I mean, we also talked to healthcare agencies. We talked to GP surgeries. And as they started, so initially it was we were getting ladies who self-referred themselves to us by seeing the posters. But more and more we're finding that health visitors, GPs, they're referring their patients to us as well. So it really has been, and it takes time. Obviously, they're inundated with so many different services. So it takes time. We've been we've had sessions, haven't we? Information sessions at GP surgeries in different places. And it takes time. So it's been over a year now, just over a year since we started delivering like properly. And I think we're starting to see the fruits of that now. So yeah, in terms of promotion and in terms of going forward. So although the starting well, this was a 2-year project, but we're now going to be including the Connecting Muslim Mums course as part of our perinatal services. So we hope to deliver 2 or 3 a year. I think initially face-to-face, hopefully we'll still do an online one, because we're currently running an online one, which is actually really it's really successful. I think it's got our biggest turnout yet, because obviously there are some mums who just can't travel for whatever reason. Maybe they've got anxiety, so they don't want, they can't leave their house. So it's worked really well. We've got 8 mums that attend nearly every week. So yeah, in terms of next steps, that's what the plan is. So we've included this service within our standard perinatal service.
Thank you, Mumtaz. I just wanted to add to that, Stella, as well, is that with the engagement, the question you asked around engagement, so we initially started off thinking that, the mosques would be a really good place to start. And I think obviously this will vary from area to area. There are different areas in the UK that are perhaps a bit more sort of, engaging, and some aren't. But we found in Peterborough that definitely the mosques were not as on board as we would have liked them to be. We didn't see them as places who would routinely share the details of the service to families. I mean, it certainly wasn't filtering down to mums who needed the help. And I think one exercise we carried out was to make sure that we'd asked every single person who came through to the service where they'd heard about us, and pretty much nobody heard about us through the mosque. So we knew very quickly that wasn't working. But I think overall our model really is that even as the Lantern Initiative, we try not to be affiliated with any one particular mosque, because there's so much more within that in terms of the politics, in terms of how communities work, in terms of what they see their role as. Some of the mosques might not see it as, well, we don't need to signpost mums to mental health support, so actually we feel we've done better by being separate from the mosques. We feel that it kind of then, we don't shut ourselves off from anybody. We're there for the whole community, regardless of which mosque you attend, what community you're from. It just leaves us a bit more open and accessible, we think, to different communities. So I hope that also helps. But yeah, in terms of moving forward, as Mumtaz said, we have got ideas as well to take more of our projects online and to make them a bit more accessible, so they're not restricted to one area either. So obviously this project was funded for Peterborough, but we'd love to be able to do something that's a bit more generic, in that other mums from across the UK can attend online as well. So if anybody wants more details on what we're doing in the future, you can also check our website for some more information about us as well, about what's coming up. Thank you. Kathleen.
I just wanted to congratulate you and to give you some support in moving forward. I don't know if everybody here understand the efforts that the Lantern Initiative has gone through. We in Birmingham, I'm from Pro-Social Parenting, have done something similar, and it's taken a huge amount of effort. You've mentioned some of the things. I hope you get the funding to continue. You definitely deserve it. You definitely need it. This is the way forward. It is organisations like this and the enthusiasm and the support, and you can see the effects it has on the service users, that we need more of, and we need to listen to more of these stories. And thank you for sharing it today. It's been really wonderful being part of your session here today, and I hope you will continue for a long time to come, because it's taken a huge effort. I can understand. I know we've been there too, and we're on the same journey, similar to yourselves, to get there and to help communities. Please, if you can spread the word, everybody here, that it should continue, and this needs to continue to be able to help and support. Sorry, I just wanted to say that to you. So well done.
Thank you, Kathleen. That's very kind. And I know Kathleen, through the Approachable Parenting organisation, they also do some fantastic work. We've also had some crossover in our work as well. So we'd love to be able to collaborate more and do more work together. But yeah, as you say, Kathleen, we would also love to be able to access more funding to take this forward. And one thing that I think some people here will be able to relate to is that when you're a smaller organisation, I think the likelihood of accessing and, succeeding in accessing funding is much more slim than if you were a bigger trust or a well-known charity, etc. So for us, this has really been something that's put us on the map. It's been one of the biggest projects we've embarked on, and it's given us the confidence really and the inspiration to kind of be brave enough to apply for more pots of funding to do bigger pieces of work like this. So if anybody's interested in doing any partnership work, please do get in touch. I think I've already mentioned it before, but thank you, Kathleen. We've got just under 2.5 minutes left, so I don't know if we've got time for one more question, if anybody has anything, otherwise we can wrap up. Okay, no more questions. Oh yeah, sorry, Katie.
Hi, Safura. Thank you so much. It's been so interesting. And I was just wondering, because the organisation that Kathleen's just mentioned that she works in, and your own Lantern Initiative, is there? I'm up in the northwest in Tameside, and I'm wondering if you've got any advice about how to find out about similar organisations in different areas.
Interesting, because there aren't, when we started doing our research, we realised there were very few Muslim organisations doing work like this. But what you could do really is reach out to local mosques to start with. That's also a good starting point, because some of them do have coffee mornings or drop-in sessions or some kind of support. That's not to say every area will have it, but of course I don't know anything about your area, so I think it's definitely worth looking into. Also, some of the local Facebook groups and social media groups are also a really good place of contact, because you can just have a chat with them, you know, the mums on there, to find out what else is happening in the community. Sometimes we think things are hidden for a long time before they become apparent. So there may be something happening in your area that's just not advertised very well, or, you know, and it's definitely worth making those connections. But if you wanted any support in terms of, you know, finding anything out from your local mosques or making connections or anything, you know, please do drop us an email. We'd be happy to support you with that. Like I said, we don't know the area, but, you know, we do know the Muslim community, and we know what sort of what perhaps the questions you could maybe ask, and how you could maybe do that. So yeah, don't have all the answers, but we're happy to support.
That's brilliant. Thank you very much.
No worries. Well, thank you very much all. I think we're shortly heading back to the main room. I just wanted to thank you again for being here today. It's been an absolute pleasure to meet you all, and hopefully we'll touch base with some of you soon.